Have you ever caught yourself wondering, maybe late at night, maybe when nobody else is around, if I masturbate every day at my age, am I actually harming my prostate? If so, you are not alone. This question has echoed in locker rooms, whispered in private conversations, and cluttered search bars all over the world. And the truth is, most of what you've heard is wrong. Some people will scare you, claiming frequent masturbation wears the prostate out, that it can inflame it, or worse, even trigger prostate cancer. But here's the shocking twist. Science has uncovered something completely different. What researchers discovered at Harvard in one of the largest long-term men's health studies ever conducted will change the way you think about your body. Stick with me because by the end of this video, you'll know not just the truth, but also the habits that can keep your prostate and your manhood healthier for years to come. And before we dive in, do me a quick favor. Hit the like button, subscribe, and tell me in the comments, where are you watching from? I love knowing where men around the world are tuning in, and it helps this information reach even more people who need it. Let's get right to it. The myth goes like this. Masturbation strains the prostate, builds up pressure, and over time causes damage. But when scientists at Harvard followed over 32,000 men for almost 2 decades, they found the opposite. The men who ejaculated more often, whether with a partner or through masturbation, had a significantly lower risk of developing prostate cancer. Specifically, men who ejaculated 21 times or more per month had up to a 33% lower risk than men who only did it a handful of times. That's not a tiny difference. That's a life-changing, potentially life-saving difference. So the truth, far from being harmful, regular ejaculation, including masturbation, can actually be a natural ally for prostate health. But why? What's really happening inside your body that makes this possible? For those of you who are new here, my name is Dr. Sarah Wells. I'm a men's health specialist, and I've been working with patients for the past 9 years, helping them understand their bodies with compassion and clarity. And let me tell you, in my clinic, this exact question comes up all the time. So here's what I want to do for you today. I'm going to walk you through the science, but also the 10 key ways daily masturbation impacts your prostate and your overall health, both the good and the potential risks. Think of this as a roadmap. If you understand what's really going on, you can make smarter choices, protect your dignity, and live with more confidence. Let's start with the benefits. Benefit number 1, prostate cleansing, the flush-out effect. Every ejaculation is like turning on the faucet for your prostate. The duct release fluid, flushing out old secretions, dead cells, and even potential carcinogens. Biologically, this helps prevent stagnation, the buildup that can irritate or inflame the gland. Emotionally, it gives you peace of mind that you're actively caring for your health. Day to day, it means that what you thought might be harmful is actually keeping things moving in the right direction. Benefit number 2, lower prostate cancer risk. As we mentioned, that Harvard study saw and a follow-up Australian study showed frequent ejaculation was linked to lower cancer risk. Biologically, scientists believe this reduces the chances of abnormal cell growth. Emotionally, it's a relief. Something so natural might actually protect you. Practically, it means you don't have to feel guilty about the habit. It's likely helping, not hurting. Benefit number 3, stress relief and inflammation control. Orgasms release endorphins, dopamine, and oxytocin, your body's natural anti-stress chemicals. High stress equals high inflammation, and inflammation is a key risk factor for cancer and prostate enlargement. So by calming your stress, you're also calming your prostate environment. Benefit number 4, pelvic floor strength. The contractions during orgasm exercise your pelvic floor muscles, crucial for bladder control and erectile strength. Stronger muscles here equals fewer accidents, better performance, and greater confidence. Benefit number 5, better sleep. Ever notice how much easier it is to fall asleep after release? That's no accident. Hormones like prolactin and oxytocin create a natural sedative effect. For older men who often struggle with insomnia, this can be a game changer. Benefit number 6. Circulation boost in the pelvis. Erections push oxygen-rich blood into penile and pelvic tissues. Think of it like stretching your muscles. Without it, tissues stiffen. With it, they stay elastic and responsive. Benefit number 7. Self-examination. Regular masturbation makes you familiar with your anatomy. That awareness can help you detect lumps, pain, or changes early, often before a doctor would. Benefit number 8. Ejaculatory control training. If you struggle with finishing too quickly, masturbation can be used to practice the stop-start method. This is private training that translates into better performance with a partner. Benefit number 9. Mood and confidence. Daily release keeps dopamine flowing. Dopamine isn't just about pleasure, it's also motivation. That little boost can make you feel more energized, more optimistic, and more alive. Benefit number 10. Keeping desire alive. Sexuality is use it or lose it. Regular activity keeps the brain's sexual pathways active, so your libido doesn't fade away. Now, that sounds amazing, right? But like anything in life, there are risks if things go too far or aren't done consciously. So, let's go over the 10 potential downsides of daily masturbation you should watch for. Risk number 1. Social withdrawal. If masturbation replaces intimacy instead of complementing it, isolation can creep in. Your body may be fine, but your emotional world suffers. Risk number 2. Skin irritation or micro-tears. Overly aggressive habits or no lubrication can lead to irritation or tiny tears in the skin. Solution: be gentle. Use a good water-based lubricant. Risk number 3. Desensitization. If you always do it the same way, your brain can lock in to one pattern. This makes it harder to respond to a real partner. Variety is the antidote. Risk number 4. Masking erectile dysfunction. If you can only get an erection alone, not with a partner, that could be an early sign of heart disease, diabetes, or hormonal imbalance. Ignoring it is risky. Talk to your doctor. Risk number 5. Poor posture and nerve compression. Hunched over in a chair, you can compress the pudendal nerve, leading to numbness or pelvic pain. Best position: lying back comfortably supported. Risk number 6. Emotional dependence. If masturbation becomes your only coping mechanism for stress or boredom, it can turn into a crutch. Balance it with exercise, hobbies, conversations. 7. Guilt and shame. Cultural or religious conditioning can create lingering guilt. This eats away at confidence. If it's heavy, therapy can help reframe this natural act. Risk number 8. Pelvic congestion. Too frequent, multiple times a day, every day, can sometimes lead to aching or heaviness in the testicles. Solution: moderation. Listen to your body. Risk number 9. Semen quality. If you're trying to conceive, daily ejaculation can lower sperm concentration. For fertility, best to allow 2 to 5 days between. Risk number 10. Porn-induced expectations. If masturbation is tied exclusively to extreme pornography, it can warp expectations. Real partners may not compare, creating disconnect. Balance it with imagination and real-life intimacy. And so, what's the takeaway here? Daily masturbation is not dangerous. In fact, it can protect your prostate, but it should be practiced consciously, not compulsively. Balance is key. Combine it with healthy diet, exercise, stress management, and regular checkups. Think of it like brushing your teeth. Good when done daily, but not a replacement for the dentist or a full health routine. Men often whisper these fears to me in my clinic. Doc, am I too old for this? Am I hurting myself? And I always remind them, your sexuality doesn't expire at 50, 60, or even 80. If anything, it becomes even more precious. It's about dignity, freedom, and living without unnecessary fear. You are not broken. You are not wrong. You're simply a man with a body that deserves care, respect, and truth. So, let's circle back one last time. What does daily masturbation do to your prostate? The shocking truth, it may actually protect it. But like any powerful tool, it's about how you use it. With awareness, moderation, and a focus on overall health, masturbation can be part of a long, vibrant, and confident life. If you found value in this conversation, hit the like button, subscribe, and click the notification bell. And tell me in the comments what other men's health myths do you want me to bust next? Remember, age is not the end of vitality. Small choices made consistently can bring you comfort, freedom, and confidence at every stage of life. Stay healthy, stay hopeful, and I'll see you in the next video. Dr. James Carter.